Welcome to Yesterday, Today, Tomorrow. My name is Mariana Cordier, and I am your host. I am coming to you from my home via Zoom. Our bodies are like machines, and we need to take care of ourselves to be able to function well and properly. However, everyday life is challenging, and we may overlook dealing with stress, finding a healthy balance between our personal lives and our work life, and considering the impact food and exercise have on our bodies. During this pandemic, many have faced issues and decisions affecting every aspect of life. To discuss these issues, we have two wonderful guests who are joining us. My first guest is Michelle Wright. She is a healthcare consultant and a very experienced expert in the area of health. And my second guest is Marko Rivera. He is the coordinator of the Germantown hub that is feeding a lot of the families in Up County. So thank you and welcome to all of you. And actually, I wanted to start with you, Michelle. I think it's an understatement what I said about your experience. You were with Care First, is that correct? In HR, and so you have this experience with what we're all trying to deal with and working during these times?
I did spend a long time working in HR, and I was the head of HR for Blue Cross Blue Shield. And I also consult to companies and to healthcare on areas, not just HR, but also on wellness and disease management and those sorts of things. So yeah, it's like looking at it from different angles, right? Your own personal angle, but then your workforce if you're helping other people and you're helping manage other people through it.
Well, what I find interesting, and I love the fact that you were able to join us, is that we've heard from doctors, we've heard from, big business, CEOs and business people about, the struggles of how to, go on and continue with a business. But hardly anyone ever gets to talk to the HR expert. And so, my question to you is, and as a consultant, I'm sure you get that, what are the challenges that you are seeing evolve out of the workforce really adjusting from being in an office in a certain type of environment to all of a sudden working from a distance or working from home?
It's everything we hear about, right? So it's everyone juggling everything. And it's also your employers figuring it out too, right? So I think in general, what it is right now is that people are feeling isolated because communication right now has to be very intentional. You used to run into people in the hallway, or you'd run into them in a cafeteria or in a meeting situation. And now the only way for people to interact with their bosses, to get feedback, to interact with colleagues is through intentional, like Zoom communications or phone calls or things like that. And even if they are an essential worker and they're coming in, it's very distracting. You're garbed up. You're trying to be careful of everyone's safety and your own. And so it's just difficult. So I think communication in general right now is very difficult, and it needs to be very intentional. And that's why everyone's adjusting to it. And as much as I see the workforce adjusting to it, I see bosses adjusting to it too. Like they don't even know. They're like, well, what can I do to help my employees? Like, please tell me what to do to help my employees, because I want to help them, but it's hard.
Well, what are some of the recommendations that you would typically give an employer or employees? Sometimes the obvious needs to be stated because it doesn't occur to us because we're so overwhelmed. But what would be a couple of things that you would recommend to make it a little bit better or more, functional?
It's so different depending if you're in a workplace environment. It's so different depending on the situation. Some people are very zoomed out, right? They don't like the whole Zoom thing. They're like, okay, another Zoom happy hour. Like, I've been sitting at this desk all day and I don't get to get up and move around the way I used to. Or it's very difficult for me to get to work and I've left my kids and and I'm an essential worker, and I've had to deal with that. I come home, I've got to deal with homework. So people are trying to do things. I think a lot of times it is understanding that sometimes what you might put out there, you think it's great, but your employees might be like, oh my gosh, not another right thing. That so I do think there's a balance there. I like asking employees. I just like asking them, like, well, let's not spend a ton of time. Let's not make it like overly complicated. But what would help you? And if you have a situation, you're an employer, maybe you take one or two people that are kind of like really good at this kind of stuff and have them brainstorm with the employees on what are ideas, right? I think the thing is, this is now, everybody overuses the term the next normal, right? But it is, right? So we have to almost psychologically for ourselves personally and help others along, whether it's colleagues or employees or whoever, our children. It's sort of moving beyond the state of crisis,
right?
And sort of like, this is where we are. So, okay, how can we not be operating in a state of crisis all the time?
Well, and I could imagine that looking down in the future when the employers start to assess, the cost and expense to find, that you don't have to pay rent for as many offices because you can get the same amount of work out of your employees while they're at home as a consideration. And, who knows what this pandemic, how it will go, since it is unprecedented. So we're kind of flying by the seat of our pants, right? But so Marko, you see a different perspective, right? First, thank you for being on the show. And, how are you guys at the hub in Germantown doing in this atmosphere of social distancing and mask and all this, able to reach out to the community to have them help you guys to be able to accumulate the things needed to help these families in Up County?
So first, thank you for having me, Marianne. It's great to be on the show. But it's a great question. And as Michelle was saying, this is kind of the new normal. At the beginning of March, when COVID kind of first hit, the Germantown hub didn't exist. So we actually created this at the end of March, and we started with only 20 families. We just heard of these families in Germantown that were in need, that needed just essentials, food. And now we're serving 800 plus this past week, and we do everything from deliveries to drive-throughs. What you asked is like, how do we reach the community, especially in this like time? Like, how do we reach out to get donations or stuff like that? It's been a struggle in the beginning, especially during COVID. When it first started, it was kind of just me and my brother going in there with our masks and making the boxes, coordinating everything with deliveries and stuff like that. Now, since we've expanded, Black Rock Center for the Arts is where we're housed. And obviously they're not going to open anytime soon under the restrictions of COVID. So we've been very blessed to turn the dance studios and the stages into pallets of food and where we make it. We have wonderful groups of volunteers. They have to pass a whole COVID waiver, take the temperature when they walk through the door. Everybody has to wear gloves and masks, and everybody is socially distanced. But even in the communities where we go, everybody has to wear a mask if they want a box of food, and that's just to keep them safe, but also to keep us safe. We have to get tested repeatedly because we're the ones that are trying to help these families.
Well, so let me ask you, because I know you said that you deliver food, but I know you deliver a lot more than that, right? I know that I hear every now and then there's a call. You guys are always short on baby wipes or wipes. But why don't you, for the audience, educate them a little bit about what is actually in those boxes?
So essentially what we created in Germantown is the hub model. And essentially what that means is it's not just a box of food. We also obtained a great size of diapers and baby wipes. And then also we do have COVID kits and hygiene kits. And those are two different kits. A COVID kit is basically if a family has been diagnosed with COVID, and that comes with a thermometer, masks, paper plates, laundry detergent, hand sanitizer, everything comes in a bag. Hygiene kits, basically between a male or a female, the male would get shaving cream, whereas the woman hygiene kit would get like feminine pads, soap, stuff like that. So the hub model is not just food. We also give a lot more to our families: toilet paper, paper towels, and was solely based on donations. People just realizing that, you know, it's not just food that we were giving. So the hub model has now been expanded, thankfully. We're now kind of operating. We were the first hub. The county has now signed up to expand it to other places in the county. So we've been working with other churches and other areas to set up other hubs. So it's fairly easy to obtain a box. We don't require basically any identification, nothing like that. It's really all based on trust. I mean, all we're trying to do is to help feed the Up County community is kind of what we're focused on, but also the other hubs that are now starting to ramp up will be basically doing the same thing that we're doing, you know, COVID kits, right, and stuff like that, yeah.
So, Michelle, from your experience of people who are working, and because we know that a lot of people who work can be the working poor and need these items, how impactful do you believe it is that they receive this assistance without any requirements of being able to, you know, meet requirements or meet parameters?
You know, it's so important. You know, I do a significant amount of work with United Way, and they do the ALICE reports. ALICE stands for Asset Limited, Income Constrained, and Employed. So it is working for the people that one little thing like a car repair can just knock them out, right? And so something big like this is so important. And what studies have shown as well already in this pandemic is that people who are food insecure, people who are living at that level, at that poverty level, do tend to have about a 1.5 times chance of more of getting severely ill or dying from COVID than the general population. And if you are homeless and you have really significant problems, that's literally like 4 times, right? So as people are moving through these categories, and they are confronting these issues, issue after issue, and it just feels insurmountable to them. You know, this is critically important right now. I mean, the work that I was going to say, I didn't know Marko before this call, and this, I will tell you, it's close to my heart. It's close to the volunteer work that I do. I'm closer to the Baltimore area, but work that we are absolutely working on, because this is what people need right now. It's basic needs. People need basic needs, and what's coming is the big, you know, what are people going to do with the money that they owe for utilities and evictions and all the other, you know, rent and housing as those bills start to come due. So that's, you know,
sure. I mean, if you have a limited amount of funds and you have to designate where goes where to be able to still have food and not have to necessarily pay for it, because you can then use it to catch up on your rent or your utilities, is a huge, huge help. I agree with that. And, you know, when I started the show, we're talking about healthy mind and body. And, you know, it always amazes me how much stress is such a silent killer, because, you know, whatever it is that could be stressing you out, if you can't find a solution, or you can't handle your stress, you can really become exposed to illnesses, and your immune system gets down. So it's super, super important. And talking about that, I was excited to hear, Marko, that you guys are at the hub going to be able to distribute free flu shots. Can you explain that a little bit to us?
Sure. That's that actually recently just happened last week, a couple days ago. So we partnered with another Care for Your Health, Dr. Ana Maria Izquierdo. She's been a great supporter of the hub, but basically what is going to happen now is when we go to our distribution sites, whether it's a low-income housing apartment building, the Middlebrook Home Trailer Park, which is the only trailer park in Montgomery County, basically any of these areas that we're distributing food, she will go with us and her team, and what they've been doing is they've been doing free COVID testing. Every single time we've gone, we've been testing that community. Now she has obtained free flu shots. So we'll be offering free flu shots to anybody in that community that wants to get it, which I think, especially in this time, is crucial, and it's important. And I think it's a great blessing to have that on top of everything else that we're doing.
Right, because I mean, they talk about, you need the flu shot to increase the odds of avoiding COVID during the winter. So, although it's so frightening when you look at the symptoms, they're so similar, so you don't know which one you've got, right? But anyway, so with regard to the community, when you're out there, because you're out there probably more than any of us are out there, what are you seeing? How are people dealing with this on a day-to-day basis?
I think there are people that are embracing it, trying to just make the best of it, basically. They understand that this is not really going to change anytime soon, but they're just trying to make the best of it. Some people, I'll be honest, are going crazy being at home with their kids 24/7, and they want to get out of there. But I've seen a lot of gratitude. I was unemployed at the beginning of March. I was actually in the healthcare field. So I saw a lot of Blue Cross Blue Shield in my day, Michelle. I was a supervisor at an eye clinic in Rockville. And then obviously, with the pandemic, I got laid off. I didn't go back. Instead, I took this opportunity and this job now to be leading the force to, basically feed the underprivileged. And it's been a blessing. But what I've seen in the communities is a lot of gratitude. I mean, these people are basically, the poorest of the poor in the richest county in Maryland, and they're smiling, they're walking around, they're exercising, they're getting outside, they know they're always wearing their masks, socially distanced, they understand the rules. But then some people are still working. And either they got laid off and got back, or they're frontline workers, and they're not like police officers or doctors, but they're custodians. They're the ones that clean the hospitals, or they're cleaners, they're frontline workers. So they're still working regardless. So a lot of these people that we've been feeding are still working, but not as much as they used to. And honestly, those frontline people, when people think of frontline workers, they think, firefighters, police officers, doctors. They don't really think of the cleaners, the people that we're feeding, the people, the waitresses, the waiters, the cooks, right, the chefs, all these people that are, that got hit the hardest and are just trying to make ends meet.
Well, that kind of raises a question I have, Michelle, for the health clinics and hospitals and the employers of these different health providers. They must be exhausted. I mean, they must be on their last legs, and we're not even halfway through. What are the things that the rest of us who are not in that industry need to understand?
Well, I mean, and I don't even think it's that industry. It's like I said, it's everywhere. I think it's just the recognition that everyone is sort of going through some aspect of this. I think if you are in a place, to Marko's point, where you are handling it, right? Like you have, someone, and you're able to manage the kids, because maybe you have a spouse who can handle certain days and you can handle the others, and you don't have that same stress. Or maybe you don't have someone sick right now, or maybe you haven't been laid off, then I think it's that, you know, what I've found for me personally, so now I'll just put on my personal hat, is you know, that's when I want to go do the things like what Marko's doing, right? So that's when you are able to intentionally reach out and help others, then, you know, I find that it puts things back in perspective, right? So I've actually, you know, been, that's one thing I've been doing for my mental health, is like, okay, in addition to sort of trying to move around every couple of hours and not just sit in a chair all day, but also to just really, you know, reach out and try to make some impact somewhere, right? And we all can do it. And you can do it even if you can't leave your house, right? Even if you're at risk and you're uncomfortable leaving your house, there's things you can do to help children that, you know, right now are having issues with school. You know, the libraries everybody's got programs and stuff. So there's things that can be done. And it is such a rich county in Montgomery County, and really across Maryland. There's a lot. Maryland is a very wealthy state overall, and I think that you know, there are many people who aren't suffering as much, who can reach out, and I think it helps your mental health, and it helps others. So
well, it's an awesome opportunity to. But because I think part of the exercise is, you know, we do the health part or the physical part of the distancing and masks and get the flu shot, and we do all that we can. But sometimes the mental exhaustion, and they talk about, you know, that, you know, people are, you know, to the point where they're not taking it as seriously anymore because it's just they're numb. Mm-hmm. But to take the opportunity to do rewarding things that mentally you acknowledge, you check off the box, wow, I really helped somebody out today. I really, you know, saw somebody whose situation is worse than mine or is the same as mine, or, you know, I was completely unaware and I made a difference. I mean, I always, you know, when you hear those slogans, make a difference, it's serious. And so I think part of the stress that we feel by being isolated is that there are opportunities not to be as isolated that might be also refreshing, right? What do you think?
Well, and I think too, I will say quickly that what amazes me about this situation is that what I'm seeing is some of the businesses and people that are most impacted, you know, like Marko, right? Lost his job, right? Or I'm amazed at some of the restaurateurs and they're the ones helping the most. So they're the ones that are the most affected, had to lay people out, this and that. And they're out there like, you know, donating food and giving food, you know, coming up with these innovative solutions where they're maybe taking donations and then using that to keep their employees employed and then donating meals to critical workers and essential workers, things like that. I mean, just when you just see that sometimes it is the people that are most affected that are doing it, and then you're kind of not one of those most affected, you kind of go like, wow, like I what excuse do I have? And like I said, you can go online. There's so many opportunities of how you can help and not even leave your home if you're uncomfortable with that. So I'm just like a big advocate for trying as much as possible to help others.
And Marko, what do you? Yeah, no, absolutely. But Marko, what do you think about all this?
Yeah, no, I'd like to echo basically what Michelle said. Actually, there's a restaurant that well, Marianne knows it, Los Churros in Wheaton. Omar, he is an amazing guy. He's great friends. Owns a small little restaurant in Wheaton, and you know he got hit pretty hard. All those small businesses in that area, and he donated prepared meals to me. He saw what I was doing and just kind of made the best of it. Wanted to make a difference to the community that I was serving, but also I wanted to make sure that, you know, we started paying him, you know, and because I didn't want him to completely donate everything, because I was like, you need to keep afloat your business as well, you know. And I think it's beautiful just to see these small businesses that have been in Montgomery County or anywhere in the whole state, you know, that have been there for such a long time, quickly turn on a dime you know, even though they're closed, but finding a way to still be involved and to still somewhat help. What I've seen is I've met a bunch of different people since this pandemic started in March, and I think it's been beautiful. I've met people from almost all over Montgomery County and some people out of the county. And what I've noticed is that what I'm doing is a blessing, because I'm trying to bring people together. And I think it's a great thing that people are calling me or sending me emails, seeing what I'm doing and being like, how can I help you? How can, you know, and what, like Michelle was saying, people want to help, even if they're very far away, or even if they're just sitting at home, stay-at-home job, teleworking, they want to help. So,
Marko, let me interrupt you for a second and let me ask you: do you guys have a website or you know, a phone number or something that people who are interested might want to reach out?
Sure. So our website is there's a tab. It's called the Up County Consolidation Hub. You just go to blackrockcenterforthearts.org, and our tab is right there on the top right corner. We also have a phone number. It's 240-912-1077. And I have a person there every day, 9 to 5. So you can call, and that's for anybody if they need assistance. If you live in Gaithersburg, north, almost to the Frederick County line, basically, and if you need assistance, feel free to call that number. We'll put you on our list for distributions and tell you the information.
That's awesome. I really appreciate you guys.
And I will say, Mariana, that I'll just put the plug in, and I don't work for them. I just do a lot of volunteer work. But United Way of both the National Capital Area and Central Maryland, depending on where you live, they work with a lot of agencies as well. They have tons of ideas of how you can help. And a lot of them are.
So you guys have to remember, the audience, you need to remember that there are opportunities for you to reach out and participate for your well-being as well as for your neighbors and community. So don't forget that. We are out of time. And so I would like to thank my guests, Marko, Michelle, for joining us. I also would like to thank the audience for joining us, whether you're watching us on your TV or if you're watching us on the YouTube channel. If you want to find us on the YouTube channel, look for Yesterday, Today, Tomorrow Show. Don't forget the last part, show. If you like the show, subscribe, like, flag, whatever that social media requires. I'm Mariana Cordier. Thank you so much for joining us. Until next time.